Hello and welcome to LGT iCare's Training Online Training Module 2. This module covers patient records within PowerChart. We will be viewing the menu bar, documentation and Connect Care.
We're going to now look at the menu bar down the left hand side. We've got a little pin there. By clicking the pin, it will widen your screen so the menu bar disappears. You can bring this back by clicking on menu and clicking on the pin again. We need to start entering information on this patient. We've selected from the left hand side the patient summary screen. Within the patient summary screen, all the information down the left hand side, adding problems, allergies, diagnosis, it all shows on the summary screen. So looking at the summary screen, we can see we've got one visit. If you click on the down arrow, it will give you more information. Looking at allergies, we've got 2 recorded, so we've got morphine and fish. Again, we placed orders on this patient. We can see on the right hand side that they have been ordered, but we have no results for them as yet. We're going to change our patient over now because I've received a phone call. I need to look at Taylor Kate. So surname is Taylor, Kate. We're going to select Taylor Kate from the list. Looking at the bottom of the screen, this time you can see more encounters, i.e. more episodes of care, some at Lewisham and some at QE. We're going to select the inpatient under Stager, general surgery, and click OK. Allergy status has not been entered, so we do need to enter an allergy status. At this point, we can see that the patient had different episodes of care. We need to make sure that we do select the correct one. We're looking at the patient on Juniper Ward at Lewisham, so make sure that that one's highlighted. If it was incorrect, then you would highlight whichever one was the correct, but we are going to select the Lewisham. The second item we're going to look at is patient information. The patient information will give you visit details. You've got a tab along the top, care provider summary, shows you who's been involved with that patient's care, and the last tab is patient demographic details with the GP. Scrolling down to allergies, we notice under the patient's name on the banner bar that the patient has got morphine and coconut oil. I will show you how to add an allergy. Click on the add button. Note at the bottom of the screen you have got different folders. We're going to give this patient a food allergy, so click on the food, and we're going to say that they're allergic to fish. Note that fish fills the substance field. You must click onto the reaction field and another allergic reaction folder will appear at the bottom. By opening the folder, you can select any of the reactions that the patient may have. I've selected 3 here, but basically they don't sneeze, so we're going to delete that. We selected that by mistake, so right click and delete. That's simple. You've then got severity. Clicking on severity, we're going to say mild. The info source was from the patient. The category is whether it's drug, medication. We said it was food, so select food and click OK. Please refresh your screen and get used to refreshing your screen after inputting information. We now look under the banner bar and it's got morphine, coconut oil and fish. We're going to say that the coconut oil was put on by mistake, so we need to delete it. Right click and cancel coconut oil. We then need to select an entry, a reason, so we're going to say it was done in error and click OK. Please refresh your screen. Get used to refreshing your screen when you're inputting information so that anybody else looking at that patient record can see the information clearly. We've got morphine and fish showing, but we haven't got anything about the coconut oil. If you click in the display window and change the display window from active to all, it will show you anything the patient has been allergic to or maybe put on by mistake in the past. So it is well worth having a look at that. We're now going to move on to problems and diagnosis. The diagnosis part is basically what is the patient coming in for this visit. We want to add. Notice there are folders at the bottom, but you can also just add abdo for abdo pain and click the binoculars. So we're looking for abdo pain. We're going to select the finding. So we're going to say acute abdomen and click OK. Make sure you select a finding and not a procedure. Where is the pain? We're saying it's on the right hand side, so click on right. The type is a working and it's been confirmed, and click OK. We've now added the diagnosis. Basically, it's why the patient has come to us this visit. We also need to add an alert on this patient. So again, within the problems, we're going to click on add. At the bottom of the screen, we've got folders for problems, alerts and infection risks. We're going to say the patient has an infection risk. So click on the infection risk folder and then select MRSA. Double click on MRSA and it will complete in the problem field. Click OK and we've added that. Procedures and diagnosis. It's important if the patient's having a procedure that you put it on the system. So we're going to add a procedure and we're going to type in appendectomy, APP. Otherwise we could select from the procedures at the bottom of the screen. Obviously the more information you put in, the table appears quicker. Select appendectomy, making sure on the right hand side where it says terminology that you are selecting the procedure rather than a finding, and click OK. The date is the date that we're putting the patient onto the waiting list, and the time is now. So you can put in N for now, otherwise select, and click OK. We've now updated the patient. They came to us with abdo pain and the procedure we're going to do is an appendectomy. Moving back to the menu, we have histories. Within histories, you can add here any past medical history, any procedures that they may have had in the past, any family or any pregnancies. Moving down to requests and care plans, we want to add a request on this patient. So we can see here that we've already had the VTE done at admission and they've been referred to speech and language. We want to add some blood tests, so we're going to click on the add button. And you can either select from the folders or just type in the search box FBC. Select it and then type in again your next test, LFT. Select it, and we're also going to do use and ease. And select. You'll notice bottom right hand side it says done. Click on done. At this point you might need to expand the screen slightly so that you've got clinical details showing in full. When you've selected more than one test to be done, rather than filling them in separately, if you click on the top test and drag down, it will highlight them all and allow you to fill in most of the information once only. So we're going to type in clinical details, abdo pain. The bleep number is 401. That is my bleep, by the way. Collection priority. Please note, if it's an inpatient, we're going to select the inpatient. For outpatient, when you select outpatients, if working in outpatient, it will automatically be sent round to the outpatient area. It can also be printed. But at this point, for this patient, we're selecting inpatient. If you're placing an order, please make sure it's done before 7 AM, so you can do it today for tomorrow, because at 7 AM their list will automatically print with the labels and they will go round and bleed the patient. After that time, it will not be done until the next day. And click sign. You'll notice now that it says processing in the status. We need to refresh our screen. So we've placed our orders. We're now going to look at any results that we might have on the patients. We're now going to look at results. Click on the results tab. The results will show you all recent results for the patient in date order. It will go back showing you the recent in the first column. You've also got showing you by group, so you can group the results. A good one to use is the list. As you can see all the way down, you can note everything together. So that is a very useful one to use. So looking at assessments, we can see that a VT assessment has been completed. Form browser on the left hand side. This are any forms that might have been completed. We've said we've already done the VT assessment, but you might also find pre-op forms within form browser. Clinical notes. Clinical notes are very important. This is where the nurses, the allied health professionals will write their notes on the patient that they're seeing. You can also add to a clinical note. We can see we've got a folder there already, so let's click on the folder. And we notice that there is a general message. When we sent a message earlier within Message Centre, anything we send will automatically go to the patient's record. So at this, we're just showing you how you would open it up. To create a clinical note, this is where secretaries would also select GP letter if they were sending one, but you're going to select a general note. The subject, it is very important that you type in the first 3 letters of your specialty followed by the date, because if you can imagine in live with everybody creating clinical notes, you would not know which was yours. You're then ready to type in, I'm just going to type in testing here. At the bottom we can see sign, save, save and close. If you save and close it, only you can see the note. Nobody else will be able to see it. By signing the note, it is public to everybody. So click on sign. We don't need to view the note because we've only put testing in. Now let's click on documentation. We can add documentation. Any discharge summaries would be there. We know that we've added a general clinical note, and this is what we've just added. So within clinical notes, anything you do can be found in documentation. Clicking on the appointments tab on the left hand side, you will notice that we have all future and past appointments. Connect Care is a relatively new system. We've got Bexley, Lewisham and Greenwich at present, with data being shared between all the GPs. We've also got access to King's, Guy's and St Thomas's, Queen Mary's Sidcup and the Prue. It deals with all GP admissions, any referrals, any discharge summaries. We're sharing the information so that it's all in one place. It will show you all medication passed, all referral letters and all discharge summaries. You do need the patient's permission to open the record unless it's an emergency.